Do you frequently feel like your heart aches sometimes? Or maybe you're always tired, even after a full night's sleep. What if it's not just stress or overwork? Imagine your bone marrow, the factory inside your bones that makes blood, quietly being taken over by strange-looking cells with hair like strands. That's what happens in hairy cell leukemia, HCL. It's rare, yes, but real. And it sneaks up slowly. You might not notice at first, but over time, your body starts giving clues, like frequent infections, easy bruising, or a bloated belly. Hairy cell leukemia isn't about hair on your skin. It's about abnormal white blood cells that look hairy under a microscope. Think of it like a factory worker gone rogue. Instead of helping, they're blocking the system. And over time, your body can't fight infections or carry oxygen well. Let's dig deeper into why this happens. So what causes these hairy cells to show up and cause trouble? Great question. Right now, doctors don't know the exact trigger, like how some people catch a cold from a virus, but HCL doesn't spread like that. It's not from bacteria or germs. Instead, it starts with a tiny mistake in your DNA, like a typo in a very important instruction manual inside your white blood cells. One key typo happens in a gene called BRAF. Yep, just one letter change in this gene leads to cells growing out of control. Imagine your car's gas pedal stuck down. That's what the BRAF mutation does to cell growth. This doesn't come from your parents, and you can't catch it from others. It's just a random mistake your body made, usually when you're older, most often in men over 50. No one's to blame. It's like winning the worst lottery. Have you ever felt stronger than a cold? Like you get sick every month, or maybe your nose bleeds when you sneeze too hard? These could be signs. In hairy cell leukemia, the hairy cells crowd out healthy ones in your bone marrow. So, your body can't make enough normal blood cells. Low red blood cells, that's anemia. You feel weak and tired, like climbing stairs feels like hiking a mountain. Low platelets, that means bruising easily or bleeding longer. Think paper cuts that won't stop. Low white blood cells, hello, constant infections, sore throats, fevers, coughs. Also, many people feel full too fast when eating. Why? Because the cancer cells collect in the spleen, making it swell. It's like a balloon in your belly pushing on your stomach. Some even feel pain in their bones. But remember, these symptoms come on slowly. It's not a sudden storm, it's a fog that thickens over months. How do doctors find these hairy cells hiding in your body? Let's play detective. First, a simple blood test, like checking the oil in your car. It might show low blood counts. But the real clue comes from a microscope. A pathologist looks at your blood and says, wait, these white blood cells have tiny hairs. That's a big red flag. Then maybe a bone marrow biopsy. Don't panic, it's a small sample taken from your hip bone. It confirms if HCL is really there. And a special test checks for the BRAF mutation, like finding a fingerprint at the scene. Once confirmed, treatment isn't always immediate. If you feel okay, doctors might watch and wait, like monitoring a small fire. But if symptoms grow, there are powerful drugs. One called cladribine can be given as a few days of IV or shots, and many people go into remission, meaning no signs of disease. Another drug, vemurafenib, targets the BRAF mutation directly like a missile aimed at the broken gene. Treatment can work wonders, and many people live normal lives afterward. Can you prevent hairy cell leukemia? That's a tough one. Since it's caused by random DNA changes, not lifestyle or germs, there's no sure way to stop it. You can't avoid it by eating well or exercising, though those help your overall health. It's not like lung cancer from smoking, where quitting helps. No virus, no chemical exposure has been clearly linked to HCL. So no vaccine or pill can prevent it. But what you can do is pay attention. If you're over 50 and feel constantly tired, bruise easily, or keep getting infections, don't just say it's aging. Talk to your doctor. Early detection means treatment can start before things get serious. Think of it like spotting rust on your car early, fix it now, avoid big trouble later. Science is making progress, and that's good news. Remember the BRAF mutation, that discovery in 2011 was a game changer. Now targeted drugs like vemurafenib and moxetumomab are helping people who didn't respond to older treatments. Imagine medicine that finds only the bad cells and leaves the healthy ones alone. That's what these drugs aim for. New clinical trials are testing combinations like pairing targeted drugs with immunotherapy. Some patients even get long-term remission without constant treatment. Also, researchers are studying why HCl affects more men and how to detect it earlier using blood tests. It's still rare, but every year we understand it better, like getting more pieces of a puzzle. There's still no cure for everyone, but many live for decades after treatment. Hope yes, progress absolutely.